So first, we wanted to show you where the surge stands right now with the latest coronavirus metrics in North Carolina. As we can see here, the numbers are on the decline across the board. State health officials reporting the daily count around 7,500 cases. You can see we're down about 63% from that peak high. Positivity also going down as well. It's down 11 percentage points from that peak last month. And as far as the patient counts, those are coming down pretty quickly. 15 straight days of declines, but we are seeing 3,500 still COVID patients reported today. So these are very high levels, Fred.
Yeah, and so it's easy to see why health workers at Atrium Health have been stretched so thin during the peak days and are still stretched to their limits right now even. That's why the Department of Health and Human Services sent a 16-person team to help them out. Chloe Leshner tells us how the assistance has helped them in the staffing crisis.
During the Omicron surge, all of our local hospitals had their highest patient counts of the entire pandemic. But Atrium officials say this Pineville location had the greatest need, and the federal help really relieved the pressure. Sometimes even the helpers need a hand.
The front lines of healthcare, I think, is exhausted and tired. But they're still in the fight and they're still coming to work and they're still taking care of people.
Omicron spread at lightning speed, filling hospital beds and temporarily sidelining doctors and nurses, leading the state and Atrium Health to ask the federal government for reinforcements. On February 1st, a disaster medical assistance team made up of healthcare workers that have been deployed in hospitals around the country was brought in, led by Mark Scherschel.
But the challenges are the same. It's, number of patients that are coming into a facility, number of patients that need to be admitted to that facility, what their length of stay in that facility is. It's the issues are the same.
It's helped cut wait times in the emergency department. Dr. Sheila Myers, the vice president and chief medical officer at Atrium in Pineville, says it's been a critical resource.
The psychological impact on the team is such an incredible lift. So not just having help, but having help of highly trained, skilled clinicians come in and join the team. A team that knows very well the many faces of what this pandemic has done.
An impact felt as we continue to come down from the Omicron peak.
It's a cup filling experience for me, not a cup draining. And you get tired and you work hard and you have long hours and, flip your schedules and travel and you're away from family. And those things are all, those are detractors, but it really means a lot to all of us to be able to help another community.
The team leaves on Sunday, but Atrium officials say with metrics going down, we are headed in the right direction and the patient count should be more manageable. In Pineville, Chloe Leshner, WCNC Charlotte.